Thank you, Madam Speaker. Colleagues, House Bill 4017 concerns the Basic Health Plan, which is a way to continue closing the gap for people who don't have health care coverage or who are paying far too much toward their health care coverage. The targets are the people who are currently at 138% of poverty up to 200% of poverty, who do have access to subsidies under the Affordable Care Act, but for whom those subsidies are really, really high. And so to date, there are only about 40% of those people that are electing to sign up for coverage. In addition to that, it covers categorically ineligible people who cannot access the Oregon Health Plan because of residency status. These are lawfully abiding or lawful residents in Oregon, the COFA population we've heard about, as well as what's called the 5-year bar. These are residents, immigrants who are here legally, but have to wait for 5 years before they have access to the Oregon Health Plan. There was a bill that was passed in 2015 to have a task force to look at these issues. I was on that task force along with many, many other people, stakeholders from hospitals, providers, insurance, healthcare advocacy groups. And there was no funding attached to that bill, but we worked out a framework to look at how could a basic health plan, taking the money that's the subsidies that's usually given to this population between 138 and 200% of poverty, how could we massage that into a way that could really lower premium costs and out-of-pocket costs for this population and reach a wider population? A well-designed basic health plan, we found, could not only significantly cut those costs and provide an affordable option not only for the 88,000 people who are in that 138 to 200% of poverty that are struggling with those costs, but also an additional 15,000 currently uninsured Oregonians. It would reduce the benefits cliff between Medicaid and Medicare and commercial insurance, and it could offer plans through the marketplace, including our innovative coordinated care system. So we have to, by federal waiver, offer at least 2. People have to have a choice of plans. But by offering it through the marketplace, we could actually further stabilize the marketplace. The bill itself directs Department of Consumer and Business Services, in collaboration with the Oregon Health Authority and stakeholders, to develop a blueprint for the basic health plan. So there's some funding now so that the kind of framework that we looked at could actually use actuarials, update the Wakely report, and let us see if the ideas that we had actually could pencil out. It would report back to the legislature by December 31st of this year, and it would also ask DCBS to report to the legislature about its recommendations for the submission of a state innovation waiver application by March 1st, 2017. If found to be financially viable, and if we adopt enabling legislation to create and implement a basic health plan, it could be established as an insurance option available on the Oregon health insurance marketplace. There were 2 amendments that were added to this base bill. One extends the annual reporting on the proportion of medical expenses allocated to primary care services by carriers, coordinated care organizations, the Public Employees Benefit Board, and the Oregon Educators Benefit Board. Currently, they are supposed to report, but that's about to end, and this would extend that reporting until January 2nd, 2020. The second amendment, which was requested by OHSU and many advocates, had a lot of support, no opposition, was through the Ways and Means process. They added an amendment that would clarify that all Oregonians will have access to participate in clinical trials regardless of their income or where they live. Colleagues, the base bill on the basic health plan allows us to take the next steps to see if a well fleshed out plan could enable better access to health care coverage for low-income Oregonians, and the 2 amendments promote access to primary care as well as clinical trials, and I urge your support. Thank you.